Good afternoon, everyone, or good morning, good evening, wherever you are tuning in to today. Welcome to the February Kapnick Strive webinar, Investing in Your Health. My name is Lexi. I and Emma will be your presenters today. And so today we'll be discussing the importance of preventative care and investing in your health. And while many of us are focused on making financial investments for our future, like contributing to a 401k or putting money into the stock market, considering your health choices and seeking preventative care now is one of the best investments you can make for your future self. Not only does taking care of your health save you money in the long run, and who doesn't like that, but preventative care also helps ensure that you have a longer, healthier, more productive life.
So everyone listening has likely received a preventative care service before. Preventative care consists of measures taken for the purposes of disease prevention or identification, not treatment of an existing disease. So generally, preventative care services include your annual well visit, routine health screenings like mammograms or colonoscopies, and vaccinations like your yearly flu shot. Health and disease are impacted by environmental factors, genetic predisposition, disease agents, and lifestyle choices. And developing a disease is a dynamic process that can begin way before a person develops symptoms. So this is where preventative care comes in. It's care that you receive when you're healthy to prevent the development of disease or identify disease early when it's most treatable. So when it comes to healthcare, most people act reactively instead of proactively. They won't go to the doctor until they're sick, and they won't take care of their body until problems start to arise. Although it might feel counterintuitive to see your doctor or do a routine screening when you're feeling healthy, preventative care is actually one of the best ways that you can promote your health and well-being. Receiving preventative care means that you are preventing problems before they occur or catching them before they become difficult to treat. So for example, if you seek out an annual well visit, you will always have your blood pressure taken. If your healthcare professional notices that it's increasing, you can start doing things to lower your blood pressure before it becomes problematic. This same idea applies to preventative screenings and vaccinations. So mammograms can detect abnormal changes in breast tissue that may become cancerous even before the person being screened notices a mass. Vaccines can prevent you from getting sick when you otherwise would have, which can also prevent major complications and death due to illness. So treating disease earlier or preventing it in the first place can increase your lifespan and allow you to live healthier for longer. Because preventative care can also identify disease before it becomes too serious, it can also dramatically reduce your personal healthcare costs by avoiding expensive treatments down the line. Now, how much does it cost? So as we all know, healthcare in the US is increasingly expensive. So why are we encouraging you to seek out more care? Well, the good news is that a ton of preventative care services are folded into what you already pay for your health insurance. So you won't pay a single extra cent for it. Most health plans are required by law to cover eligible preventative services at 100%. That means no out-of-pocket costs for you as long as you get preventative care services from a doctor or clinic that your plan covers. And by no cost, we mean you pay nothing to visit the doctor, being copays. There's no sharing the cost of your care with your plan, coinsurance, and there's no amount you have to pay yourself first before your plan helps, which is that deductible. So we know that seeking covered preventative care services presents no extra cost to most insured people, but we still see today that many people avoid seeking out these services. In 2015, only 8% of US adults aged 35 or older received all recommended high priority appropriate clinical preventative services, and nearly 5% received no preventative services at all. So these stats demonstrate that close to 90% of at-risk adults are engaging in only some preventative care practices. For example, getting their annual flu shot, and are skipping out on others, like going to the doctor annually. In addition, 5% of the adult population is not receiving services at all, which means conditions like high blood pressure can go unchecked and lead to serious complications and the development of chronic disease. As we mentioned, the gap in people seeking preventative care is directly correlated to the increasing burden of chronic diseases in the US. Chronic diseases are defined broadly as conditions that last 1 year or more and require ongoing medical attention or limit activities of daily living or both. So chronic diseases such as heart disease, cancer, and diabetes are the leading causes of death and disability in the US. They are also leading drivers of the nation's $4.1 trillion in annual healthcare costs. And many of them are largely preventable. Among US adults, more than 90% of type 2 diabetes, 80% of heart disease, 70% of stroke, and 70% of colon cancer are potentially preventable by a combination of healthy lifestyle changes and preventative care practices. In 2014, 60% of Americans had at least one chronic disease or condition. Chronic diseases can profoundly reduce quality of life for patients and for their families, which affects enjoyment of life, family relationships, and finances due to costly treatments. Working can be difficult for people with chronic diseases, and rates of absenteeism are higher and income is often lower among people who have a chronic disease compared with people who do not have one. Functional limitations can also be distressing, and depression, which can reduce a patient's ability to cope with pain and worsen the clinical course of disease, is a common complication. So we've talked about how chronic diseases can be a burden to both individuals and the healthcare system. So in 2016, total direct costs for healthcare treatment of chronic diseases were more than $1 trillion, with diabetes, Alzheimer's, and osteoarthritis being the most expensive. If lost economic productivity is also considered, the total cost of chronic diseases increases to $3.7 trillion, which is close to 1/5 of the entire US economy. These costs are expected to increase as the population ages, and projections indicate that by 2030, more than 80 million people in the United States will have at least 3 chronic diseases. As we mentioned in the last slide, managing a chronic disease is also very burdensome at the individual level, from paying for medications, getting surprise bills after receiving treatment, and or being unable to work. Chronic diseases can present a variety of financial challenges, causing some people to lose their savings or even declare bankruptcy. In addition, managing a chronic condition often means years of pain, discomfort, and co-occurring mental health problems like depression. So it's no question that all of us would like to stay healthy throughout our lives. Although prevention is not guaranteed to cure all, integrating healthy lifestyle choices and preventative care practices is hugely impactful for limiting the burden of chronic diseases and mortality at the population level. So just as you would consider making a contribution to a 401k, we encourage you to think about what strategies you can incorporate to invest in the health and well-being of your future self. First up is locating a primary care physician. So if you don't have one already, one of the most important steps you can take is to locate a primary care physician or provider in your area. Your primary care doctor is your medical home. It's the doctor you visit for most medical needs, including preventative services like your annual well visit and routine screenings. You visit them for non-emergency illnesses like earaches and sore throats, and they're the person you speak to about your health questions and concerns. So when finding a doctor, be sure that the provider accepts your insurance to make sure that your costs stay as low as possible. This is often referred to being in-network for your insurance. To tell whether a doctor is in-network, you can call the number on the back of your insurance card, or you can access your insurance provider database if one is available. As you're looking for doctors, you'll also notice that some PCPs have areas of expertise. For example, some may be family practice doctors, meaning they are able to treat patients of all ages, from newborns to the elderly. It's important to make sure that your doctor fits your unique needs. Your doctor can also help you coordinate any preventative screenings you may be eligible for. Now, before seeing your doctor, it helps to have an idea of what preventative screenings you might be eligible for based on your age, sex, and family history. If your doctor doesn't bring it up, be sure to ask about any screenings you might be recommended to complete. If you want to learn more about advocating for yourself while at the doctor's, we recommend checking out our most recent monthly webinar on patient empowerment. Your doctor can help coordinate this care and inform you about the risks and benefits of screening. Doctors refer to the U.S. Preventative Services Task Force for guidelines on what screenings are recommended for whom. So this task force makes evidence-based recommendations about preventative services such as screenings, behavioral counseling, and preventative medications.
Thanks, Emma. Alongside preventative care, incorporating healthy lifestyle changes can also help reduce your risk of developing a preventable chronic disease like diabetes or stroke. So changing your habits now, even if you're not experiencing symptoms of disease, is a great way to invest in your health for the long term. And the 5 lifestyle factors that we'll focus on today are significant contributions to chronic diseases: lack of physical activity, unbalanced diet, tobacco use, excessive alcohol use, and mental health management. Now, we're just going to list 5. There are many other factors, but these are some of the main ones. So starting off with increasing physical activity. As recommended by the U.S. Department of Health and Human Services, adults should be getting at least 2.5 hours of moderate intensity exercise every week. And this could be broken down a few different ways. It can look like 20 minutes of exercise a day, every day of the week, around 35 minutes of exercise 4 days per week, or just over an hour of exercise 2 to 3 days per week. Now, for anyone who is not currently as active as they may like to be, we have 2 main tips for you. First, start slow. Don't feel like you have to meet these recommendations in your first week you start exercising. Maybe it's just starting to incorporate a 15-minute walk on your lunch break a couple days a week, and then increase the length of your walk or add into other forms of exercise as you gain comfortability. Next, find movement that you enjoy. Moving your body shouldn't feel like a chore. It should be fun. It can be fun. When you find a form of activity that makes you feel good and that you enjoy, getting enough exercise will come much more naturally. If traditional forms of exercise like weightlifting or body weight exercises aren't your cup of tea, we encourage you to think outside the box. Maybe it's having, a dance party within your living room. You can get the same health benefits from doing something like dance classes, playing pickleball, jump roping, swimming, yoga, bike riding, and more. Next is balanced nutrition. And while this could be an entire presentation in itself, some of the most broad recommendations for balanced nutrition include: 1, making most of your meal be vegetables and fruits. Maybe it's just starting to incorporate more plants into your diet. Limiting red meat and processed meats and opting for sources of protein like fish, poultry, beans, and nuts. Cooking with olive oil instead of butter. Skipping sugary drinks and drinking water. Again, take these changes slow. Maybe it's just starting to switch, cooking with olive oil instead of butter, or reducing your intake of red meat. If you eat red meat 4 days a week, how about trying for 2? People tend to have the most success when making small changes over time, rather than doing a whole dietary overhaul at once. Quitting tobacco. If you're currently a smoker, taking steps towards quitting is one of the best decisions you can do for your health. Quitting smoking has many benefits. It reduces the risk of premature death and can add as much as 10 years to life expectancy. It reduces the risk of many adverse health effects, including poor reproductive health outcomes, cardiovascular diseases, chronic obstructive pulmonary disease or COPD, and cancer. Benefits people already diagnosed with coronary heart disease or COPD. Benefits for the health of pregnant women and their fetus and babies. And it also reduces the financial burden that smoking places on people who smoke, healthcare systems, and society. So if you are interested in quitting or starting to quit, there are many free resources that you can explore for support. And we have listed a few on this slide. So there's the smokefree.gov, which you can build a free custom quit plan, learn about nicotine replacement therapy, and speak with experts for support. There's the 1-800-QUIT-NOW phone number, and you can call this for free quit coaching and referral to resources, or you can contact your local or state health department for resources that may be free or discounted. For alcohol use, to reduce the risk of alcohol-related harms, the CDC recommends the adults of legal drinking age can choose not to drink or to drink in moderation by limiting intake to 2 drinks or less in a day for men, or 1 drink or less in a day for women on the days when alcohol is consumed. The guidelines also do not recommend that individuals who do not drink alcohol start drinking for any reason. And if adults of legal drinking age choose to drink alcohol, drinking less is better for health than drinking more. And drinking at levels above the moderate drinking guidelines significantly increases the risk of short-term harm, such as injury, as well as the risk of long-term chronic health problems, such as some forms of cancer. So if you're trying to cut back on your alcohol consumption and finding it to be difficult, there are a variety of options for treatment. You can seek out a therapist who specializes in substance abuse, look for outpatient treatment programs, or consider inpatient treatment if that's necessary. As we discussed, chronic physical health conditions often contribute to the development of mental health issues, but the relationship also works in the other direction. Epidemiological studies have shown that 50.6% of people with mental disorders also have a chronic medical condition. And this highlights the importance and value of taking a holistic approach to care. Stress or anxiety that is left unchecked can increase your risk for high blood pressure, heart disease, obesity, and diabetes. Untreated depression also increases risk for many of these health conditions, in addition to taking riskier behaviors like engaging in alcohol or other drug use that can lead to further health complications. Therefore, it's really crucial to consider the state of your mental health when investing in your health as a whole. If you're currently struggling, be sure to look into resources like your Employee Assistance Program, EAP, at work, talk to your doctor, or consider starting therapy or another route of treatment. So generally, we are all pretty aware of which lifestyle choices are best for our personal health and well-being, but we can often forget our why. And we encourage you to take a moment to reflect on the questions on this slide and consider some of the motivations for making healthy changes now. So starting off, if I decided to make some positive changes, what could be the worst case outcome? What could be the best case outcome? How might my life look differently in 5 to 10 years if I did make some changes? And what are some of the reasons why I would like to live healthier for longer? For those of you who are curious about learning more ways you can invest in your health, we really encourage you to look into what's already available at your disposal through your employer and your insurance. Does your work provide an EAP for mental health resources? Are you eligible for a chronic disease management program through your work or insurance? Are you taking advantage of having your annual well visit covered by your insurance? And when exploring changes to your nutrition or physical activity at an individual level, we also advise that you seek out support from experts like the doctor, physical therapist, or a registered dietitian. And teaming up and having partners in accountability is a great step towards a healthier life. So, thank you everyone for joining today's presentation in investing in your health. We hope you join us for our next webinar on March 29th at noon Eastern Standard Time on my personal favorite topic, your relationship with food. Thanks everyone.